I'm Dr. Kiran Chokha, sports medicine, joint replacement and orthopedic surgeon. I have been practicing sports medicine, orthoscopic surgeries, joint replacement surgeries since last 11 to 12 years. I have operated more than 4 to 5,000 surgeries. Among that, I have done more than 1,000 knee replacement surgeries. Today, I'm here to talk about joint replacement surgeries. Post knee replacement surgery, I always encourage my patients to keep their ankle mobile, in sense I ask them to keep the ankle moving up and down. We call it as ankle pump movements whenever they're lying on the bed. I always tell that post knee replacement surgery, if they're capable enough, they have to keep moving the ankle. The next is they have to sit at the edge of the couch and keep bending their knee as much as possible and making it straight. Then the do's and don'ts regarding the joint replacement surgery is that for initial few days, at least for 3 weeks, they have to take care of the knee in a much better way. They should not wet the dressing. If there is a waterproof dressing, it doesn't matter, but the patient will himself or herself will feel if there is a seepage of water into the dressing. That should be prevented. If there is a soakage, they have to see the doctor as soon as possible. That is first thing. Second thing is they have to avoid climbing stairs with the operated leg. If they have got one leg operated, they can use the other leg to climb the stairs. If both the knees are replaced, for 3 weeks they are not supposed to climb stairs. And they are not supposed to squat and sit for 3 weeks. Post 3 weeks, they can do that thing.